and it's a pleasure to present you, Joe and Shawnee. Joe, you got your PhD from Essex a while ago, then you moved to University of West England, Bristol, and now you've been at Warwick for, I think, at least 10 years. We started together, I think, around 2012, is that right? And yeah, you are specialized in applied linguistics, focus on language and migration, workplace settings, methodology. You're also the initiator of the IMEAN conferences, which I really enjoyed to attend. You're presenting together with Shawnea Ting, who is working on healthcare. Shawnee came from Hong Kong to do her PhD at Goldsmiths and is now a research fellow at Warwick together with Joe Angouri. Very good to have you both here. The title of your talk is Privacy Conscious, Unconscious, Risk Negotiation and Critical Care Dispatch. Thank you very much.
Okay, thanks very much, Johannes. And as I said, great to be here and share some of the work that we are doing as part of the project. And you already see one of the characteristics of the team, which is a very sort of unique for the kind of work that I'm involved in the sociolinguistic and which is to actually from inception to have a number of stakeholders involved. And we were going to talk more about the significance of that and also the theoretical and analytical value that it actually adds to our sort of work. If we move to the next slide, you will see the colleagues, the name of the colleagues. It's great to be here today with Shawnea, and what we are doing is to actually share some of our preliminary findings or our first findings, because we have now been working on the project that we're drawing on for about 2.5 years, although the team has been working together for much longer. It is designed from the start as a collaborative project that aims to make contributions both in the theoretical and analytical and methodological part of the work, but also to translate its findings as we're actually going along to training and policy, and we'll talk about that. The project, actually, what we're looking for is to understand the decision-making landscape in the space of emergency services and specifically ambulance critical care dispatch. We'll say a little bit more about that, but we're not going to exhaust the context. We're going to actually direct colleagues who are interested in the complexity that the context itself brings to various resources that we have already produced. What we're really looking to do is to understand how decisions are made for help to be dispatched, and this is ambulance, land and air ambulance, which is fully equipped. So it's actually the most important, most finite resource we have, which is the critical care dispatch. What we want to understand is how risk is negotiated, indexed, and communicated, and how that then translates to decisions to dispatch or not. The important part of that is that we know parts in terms of we know a lot from both the sort of the social science and the health science end, if you want, about parts of the system. But what we actually don't know is how all that system and all the stakeholders involved in a dispatch decision actually work together. And this is something that it's a very significant gap. Of course, it is something that to this date, I still find it a sort of a critical gap, that it is disproportionate under-researched for the significance of that and the impact and the relevance that it has to the lives of everybody. So what we're actually looking there is to map the work of all the stakeholders involved to landscape the decision-making trajectory and to understand all the sort of nodes, all those points where information, risk-related information is flagged, indexed, contextualized, recontextualized, and how that works. And of course, these are also points of potential information loss, which have the obvious consequences in that space that I'm not going to take more time to talk about. So what we want to do with that is we are using an interactional sociolinguistic approach. I'm going to pass on later on to Shawnea to actually show you what exactly and how we implement interactional sociolinguistics. But what we are very interested also in doing is using our established methodological approaches to translate those to training and to policy. And we are drawing primarily on the 999 Respond project, which is, we often refer to it as the mother project. But if you Google it or you actually follow some of the links that Shawnea we can put in the chat to take us to what we're building as a sort of resource pages for our projects, you will see that we are also completing a number of other satellite projects that actually look into this very complex ecosystem that we're researching, and where we have a number of issues that, in a sense, it constrained and regulate the work of the teams that are involved. So the data, we can actually move to the next slide. You can actually, I think, you get a sense of what we're trying to do in line with capturing that multifactorial, multi-actoral system that we want to landscape and study. We're collecting also the relevant part of the data set, where basically we have if you want a full pack of what's happening from the minute we have us as the lay user calling for help, that in the UK context comes through the 999 line, or in the sense for colleagues from other parts of Europe, 112 lines and so on. There is always a dedicated channel, and then we're interested in what happens from there all the way to actually the sort of the end of that case. We know quite a lot about the call taker caller interaction in different emergency environments, of course. In my end of the world, the sociolinguistic, interactional sociolinguistic and interaction traditions have really focused into that kind of encounters. But what we don't know is how exactly that maps in the work of the front and the backstage, as we would say. And for that, as you see on that list, we are collecting all the different texts and all the actual, we're trying to have a full footprint of all the stakeholders involved in each case. But we're also going into the institutional order, and we're interested in understanding the policy environment within which those teams operate. We have already completed one project on looking into that, and we have another project ongoing, but this is a conversation for another paper. However, what we want to see is what's happening and capture all the data that come with the stakeholders involved in the case, and position this into the wider institutional and obviously broader sociocultural order. So we're moving into the next slide, where basically what we want to do is, in our words, if you want to actually, true to the interactional sociolinguistic tradition, to be able to connect the situated encounter, to be able to connect the interaction between both the caller and the system through the call taker with the other teams that are involved, and you will get a sense of the complexity in a minute, and also be able to actually look into how can we understand the decisions that are made or not made, and of course through that how we can actually feed into making best use of resource, the current resource, but also feed into the tools that would actually make future systems resilient. Obviously, we are in a system where we actually have many more calls for help that we have resource. This applies to both the sort of normal, if you want, ambulance, and certainly the critical care ambulance. So we actually want to, we're looking from an interactional sociolinguistic perspective, obviously to anchor our study and our inquiry on the kind of this situated encounter, but of course we actually want to also understand the context. Which takes us to a very important point, because of course for anybody working in with any of the ethnographic traditions that sort of socio and applied linguists have actually adopted, adapted, and adjusted over the years, the question is always how much context we actually need and how we translate that context into a way that would provide us ways to draw inferences, to find patterns that then we can actually use to inform, in a sense, our understanding of what is happening into any sort of encounter. The point that I have been making with colleagues and we're developing and using also the sort of those cases to illustrate is that this is a critical question that differentiates interactional sociolinguistic to other interactional approaches, so conversation analytic approaches. And interactional sociolinguistic from the very start had a very strong focus on the impact, the translatability of the sort of the linguistic analysis. And it also never came with a very specific blueprint or a playbook of what and how to actually sort of necessarily collect and infer through linguistic features. So it's by nature quite eclectic, which actually also makes it very difficult, particularly for those who come new, but also for those who actually come and have a more sort of structural understanding of interaction and try always to actually find a way to make those connections between the micro, the meso, and the macro. And these are conversations I had in all the projects I've been in and all the studies that I have supervised, where basically the question and often the struggle is how much do I know that I have strong patterns, and how do I capture, systematize, codify all the other layers that I collect through ethnographic observation or ethnographic work to actually connect through the actual what's happening into the situated encounter. So we have introduced a model under the name Paths, where we actually are using it both to capture the textual trajectory into the complex system that we are studying in our projects, and then we can move to the next slide. And we actually are using Paths also as a model that we want to open to our field. And I'm very interested in how colleagues in this call today see the model and the usefulness and the relevance for projects that you are involved in, to actually really capture textual trajectories, draw and systematize the sort of the work we do through collecting ethnographic information, and also bringing the interactional tradition with the Heimsian legacy into a sort of a heuristic that can be applied and used in different studies. So this is one of our publications that actually provides both an overview and the model that we're using today for this talk. And of course, that's something that I'm very keen to also explore after, if any colleagues want to actually have questions after the call and so on. So Paths stands, it's an acronym, it stands for the actors, the text types, the sequencing and the temporality that we actually, that is present in any complex system, the very fraught relationship between stability and change in text production, text access, and recontextualization of information, and of course the actual setting and the multiple settings where these texts interact with one another and with human and non-human actors. The Paths emerged from our analysis, so it's very much a bottom-up. So we are applying it and we're developing it through the work that we're doing in our projects, and it is of course informed, as colleagues would see, as already said, by the Heimsian and the interactional tradition, and is actually trying to do sort of to provide a way for our analytical approach to actually be able to offer something that would help the work we do in our context, which is very complex, as you will see in exactly one slide's time, but also to open it to colleagues who actually are using interactional sociolinguistics, particularly in complex professional settings, but obviously any setting can be complex. So that's sort of what we mean by that is actually a, sort of a matter of another conversation, but to actually provide a way that we can actually systematize and sort of strengthen observation and our patterns. So if we actually, I'm going to pass on to Shawnea to talk through what and how we applied the sort of the paths and how we use it. If Shawnea, we move to the next slide, and I will pass on to you. Shawnea is going to actually present from the kind of the different elements of path that form paths, but I wanted to pause for a minute because I've been saying that we don't have the time to really talk about the complexity, but what is often visible when we call for 999 help is that there's a call taker who often is perceived as the decision maker. The call taker does the triaging. So what I want to pause for a few seconds before starting going through paths to actually look into the number of actors who are involved and the complexity that we're actually dealing with, and to see what we're trying to do, which is each of those stakeholders would produce different types of texts and would be regulated in different ways. And this regulated environment that is actually really fundamental in constraining human interaction. And Shawnea is going to say a little bit about how that starts already with the work of the call taker. So Shawnea, over to you.
Thank you, Jo. So we went to the ambulance control room to do some observations, and based on our observations, we came up with this representation of the actors that we think are more salient to critical care dispatch, and we put them here. And what we need to know, or what we can see, is the actors involve not just the human beings, but also the non-human beings, namely the computer and the different texts that are co-produced with the human beings and the computers. And as Jo mentioned, a lot of language and interactional research focused on the interaction between the caller and call taker, which you can see on the left side of the figure. And what we do is to show the audience, to show the readers that beyond this caller-call taker dyad, there are indeed a lot of other actors behind the scene. And what we try to do is we try to capture who are these people, who are these actors that are like salient, and also, as Jo mentioned, what their roles are, because understanding their institutional roles will help us understand their priorities or responsibilities, and therefore understand how they may utilize the text differently, how they may read the text differently according to their own institutional roles and priorities and responsibilities. And so we capture the actors, including the human beings and the non-human beings, and we try to see how information flows in this setting. And by doing that, what we do is instead of looking at the humans, we try to look at the text. For instance, in our context, the SOE, which is the sequence of events record, is a very important text. So we try to look at this SOE as the protagonist of the story, and we try to trace that as this SOE passed through different actors in this setting, who will interact with this SOE, and when the actors interact with this SOE, will they, let's say, produce more text within the SOE, or will they just like read the information and then pass it on and let it go? So what you can see is we have different arrows of different colors and patterns, and they show us how the SOE would be, first of all, produced on the left-hand side of the graph. You can see the purple arrow, and afterwards, with the blue arrows, it shows how information and text would go to different people and actors, and at the same time, the orange arrows will show that production is not linear, because there will be different actors who can, via the call taker or the computer system itself, affect the co-production of the SOE. And then what we try to capture is also not just the actors that we can see within the ambulance control room, but also on the right-hand side, you can see the auditor. So that is an actor invisible in the control room in that space, and yet people know that this actor exists and would regulate or audit what the caretakers do, and therefore influence how the caretakers behave or interact with the caller. So that's why even though the auditor on the right-hand side is invisible in that space, that there is also a huge influence. And I think what we forgot to mention is the blue line here signals the ambulance control room, the space in the control room, the physical space. And then within this physical space, we have the pink line here, which represent the provider of the critical care services. And critical care services differs from the standard ambulance services in the sense that they are an add-on, and they provide more advanced clinical treatment or intervention that the standard ambulance cannot provide because of, for example, legal reasons. They are located in the same physical space, and yet their function is a little bit different because they want to see and review which calls or which patients would deserve, would warrant more advanced clinical help. So that is what the people and the tags in this space are about. So so this is what we try to do to capture the setting. So all the actors and the all the human actors and the non-human actors do. And if we zoom into certain elements of this graph, then we will go to the first element in the paths model, which are the participants, meaning the actors. So what we also try to do is, if we look only into the actors, then we can see that certain actors focus more on the decision-making aspect. And what they mainly do is to read and utilize the text that they can see in the setting. But then they cannot make any informed decision-making if the information is not produced. So what is also very important would be the different actors that produce the text. And so we have here the call handler, the computer, as the main actors that produce the text. But then there are other actors that would also affect the co-production of the text. For example, we also have this clinical support desk, which is a group of clinicians responsible for reviewing the calls. And then we also have some other actors, such as the call handler supervisor and the other operational staff, including dispatchers, who can influence how a case would evolve by adding something onto the SOE written record for the other actors to read. So, so that is this graph is to show people or readers that we have actors in the system, and they may be responsible or mainly responsible for different things, but then overall they are still very important to the research focus, for our case, the critical care dispatch. And then, so that is the first element of paths. The second element of the paths model would be the artifacts, so the text type. So what we try to do is, among all the different texts that we can see in the setting, we capture those that are more salient to dispatch decision making. And among these texts, some texts are what we call stable, and they would remain constant. For instance, we have the MPDS protocol, which is the protocol used to train the call taker how they should handle the calls, and also the protocol that gives rise to the computer system, the architecture of the computer system. So the call takers would handle the calls through the computer system step by step, and is completely scripted. And this MPDS protocol is the text that gives rise to the text, script that the call taker should follow. So it remains constant in this setting. And then in this setting, we have other texts, including the emergency phone call, the SOE, the sequence of events record, and also the CAD, the computer assisted dispatch system. And these three texts would undergo changes or would be different in every emergency call. So what we try to do is we capture the salient text, and then we think about, and visualize how they would remain constant or if they would undergo changes, and also to look at the interactions between these tags as they go through different transitional stage, which I will show you in the next slide. So, for instance, we know that in relation to the previous slides that I showed you, the MPDS protocol dictates the architecture of the call handling. So that's why through the call taker, the MPDS protocol would give rise to the production of the emergency phone call. And then the information of the emergency phone call would fit into the production of the CAD or the SOE. So for example, all the information, not all, but the information that the call taker obtains through asking the caller some key questions from the MPDS protocol would be transferred to the SOE, which is a text that all the other actors can click through and read about. But then certain information would be highlighted and go to the CAD. A CAD on the computer screen is like a table. It's like an Excel sheet, for example. There are columns and rows. Each row is color-coded differently to show the priority level. And then each column would show some important information, such as where the patient is, how old the patient is, the kind of chief complaint, so whether it's a travel accident or whether it is, for example, a fall or whether it's a heart attack, for example, and then a text that highlights the problem or the reason for call. So we have a sequence of the text production, and at the same time, we know that this sequence of text production is different from the sequence of accessing the text, because for the actors in the control room, what they see first is indeed the CAD on the left-hand side. It is through looking at the CAD, then they would see whether there are any cases that catch their attention. And if they're interested in a particular case, then they would click on the CAD and then access the SOE. So that's the first step. And if the information on the SOE is not enough, then what they would do is they go to the CAD and then click another button to access the recording of the emergency phone call and listen to the voice recording. What they can also do is, if they are quick enough to spot a case on the CAD when the emergency phone call is still alive, then they can click through the CAD and then listen to the emergency phone call live, and then add in some notes, like type some written notes on the SOE. Then the call takers will be able to ask those extra questions live to the caller. And so understanding this kind of temporality in terms of text production is important, because it would affect how we read the text, as I will show you in some examples later on, because the production of the text will change according to who can affect the production of the text live or not. And what I would also like to add is, in terms of historicity, we say the MPDS protocol remains unchanged, but then even though the emergency phone call and the CAD and the SOE will undergo changes, it doesn't mean that they will undergo changes forever. So for instance, the emergency phone call will stop undergoing any changes when the phone call basically ends. So that means when a caller hangs up the call, then the phone call will become permanent, a kind of historical record. So that means only the CAD and the SOE will undergo changes. But then the CAD will stop undergoing changes after a first resource is dispatched, or after a clinician has finished reviewing the call and say that, okay, the priority level assigned by the computer is accurate. And so that means then the SOE would become the only text that will still undergo changes. And the SOE will stop undergoing changes when the whole case is closed. So that, for example, the patient is handed over to the hospital and all the teams are cleared. So that is another aspect of historicity that we observed. So now what we will do is we try to show you some text to help us illustrate how we can use the paths model to understand text trajectories and also to illustrate how text trajectories will work in this context. So this is an extract of the SOE that we have got. Certain lines are removed to help readability. So on the SOE, what we can see is the time on the left-hand side, and on the right-hand side, we can see, not in here, but in the real SOE, we will see the name of the actors. And then from the name, the other actors would know their institutional roles, so whether they are a critical care practitioner or whether they are the call taker or the call handler. And then in the middle, you have the main content, and the content could be generated by the computer as kind of automation, or they can be some notes that are typed in by the human actors freely in an unstructured way. So in this particular example, what the other actors can see is a problem text asking what's the problem, and then here the call handler wrote the patient jumped out of the window, looks like the lower leg is broken. So what we understood is it probably captured the attention of the critical care practitioner very quickly, because you can see that within 3 minutes, the critical care practitioner added that the clinicians are listening in to the call. And then the call handler added a free note, patient has jumped out of the window to escape. So adding a bit of information to contextualize the accident. And then what you can see is highlighted in yellow, the critical care practitioner posed 3 extra questions for the call handler to ask. But then if you look at the notes right after each question, it doesn't make a lot of sense, because the critical care practitioner asked, are there any other obvious injuries except for the leg? And then the next line says 15 to 20 feet high the window. So it doesn't really correlate very closely. And then the next question is bone sticking out through skin? But then the next line of text says his leg is bending the wrong way. So it doesn't make a lot of sense if we just read one text. So it is when we access the phone call, and in this presentation, we use the transcript and we put them side by side, then we can see that indeed, and I've highlighted in yellow, the questions posed by the critical care practitioner were asked by the call handler, and the answers were given by the caller, and the caller did answer the questions directly. So that means the clinician listening to the call did get the answers. It's just that the answers are not written on the SOE, but from the spoken interaction, the answers were there. And then what the call handler wrote indeed relate to some other things. For example, here 15 to 20 feet high the window is actually a note before this transcript aspect appeared. So it's an information that the caller gave when the caller answered the previous question. And then similarly, so here, his legs is bending the wrong way, which appear after the second extra question, is indeed in line 161 to 63, is something that the caller gave when the call handler or call taker was asking another question. And what I have highlighted in blue here are the questions from the standard scripted MPDS protocol. So what the call handler was doing when we look at the transcript is that the call handler was interweaving or mixing the standard question from the standard protocol with the extra questions. And then the answers were either accessed by the clinicians synchronously by hearing or by looking at the SOE. So that's why we need 2 texts, and we need to read them side by side so as to make sense of both texts, because if we don't have the transcript, just looking at the SOE, we can't make sense of it. And similarly, if we just look at the transcript, then we wouldn't know where the yellow questions come from, because the standard questions will only be those in blue, and we would be like, who asked the call handler to ask these things? So it is only through reading the 2 texts together, then we know how the 2 texts influence each other. and how, for example, in this particular case, an extra actor and an extra text participated in the co-production of the emergency phone call as well as the SOE. I'm a bit conscious about time. Joe, what do you think?
Yes. So thank you. I will just say one thing about if we go to the previous slide, and then we will jump to the end, because I really want to make sure that we have time. And some friends already said that they would have to leave. So I want to make the most of our time. So what we're trying to show here is to give a feel of course, the work that the multiple actors do, the relationship between the human and non-human actors, and how, in order to be able to understand the system, this ecosystem, and that's why from the start I said that the emphasis for us is to actually to landscape, to understand the trajectory, and to map the work of all the core stakeholders. And of course, to use this so that we actually bring visibility to this into both the training and how call takers are trained, and how they're audited, and how the system understands what's happening in the interaction, and how lay user, when they are in the interaction with the institutional system, we actually have two codes, two varieties there that actually are in the interplay. We have the protocol, which I know that we've thrown many acronyms at you, and this is actually the very simplified version, because more stakeholders can add to that complexity. But what we actually have is the call takers who cannot deviate from the protocol, the scripted system that they have to sort of follow, and other teams that actually have to make do the most with the text that will be accessible to them in a particular strict sequence of events. I hope you get to see how both paths emerged, but how we're also hoping that it gives a tool for actually landscaping and understanding what are the key parts that we need in order to be able to draw inferences, to understand what is happening, what is going on, and why something that is actually happening has the sort of how it actually impacts the trajectory of the decision making in the context. Now, this relationship between the lay user, the first order, and the system is actually really very important, and that is something that scripted systems do not capture. And the multiple different tools that support this decision-making architecture can also be improved by sociolinguistic, and particularly this interactional sociolinguistic evidence that we can bring. And that's, I think, what is actually very, very special about this project, that it is a project that brings IES at the very heart of it. So I want to just give you one example. We are looking into parts of that, and we don't have time to talk about it. So if we move to questions, which is, we wanted to actually also zoom in on that. We're only going to actually show you one, which is to show how some questions that are designed to be simple, simple as in critical for the system, but also designed in a sort of architecture that, and a sort of particular morphosyntactic way to actually communicate with the public is very difficult, and it's actually can trigger a spiral between the caller and the call taker that would then impact on the system, as Shawnea showed. So what you actually are seeing here is a very important question, which is whether someone is conscious, and this you can read or skim read, but what we actually are seeing here is the struggle that we actually have between the call taker, who wants to actually get an answer, needs to get an answer in order to be able to move on, because call takers cannot deviate the sequence and the structure and the wording that they have to follow, and the caller who does not commit in the way that the system would ideally like the lay user to commit, so that then that can actually help the categorization of any scripted system. Now, we don't have time to go through the whole process of it, but you can actually see the amount of talk. You can actually see what is happening between the two parties, and how they both, in terms of linguistic features that we would have on hesitation, and also on a sort of repetition, we have an evidence that it's the spiral, the trouble is actually increasing. And that obviously it becomes even more important in the open questions that we don't have time to talk in detail, but you can find some of that in the materials that we have, and I know Shawnea has already directed on the site. The important point here is that what, in a sense, we're hoping that we start sharing with colleagues through the work is all the important part of understanding this multi-actor process of the sort of in that particular setting. Shawnea, are we happy to jump straight to where more information can be found? Or is there anything else that you think would be important to add, particularly on this, on how particular questions of MPDS is troublesome? No, I think Shawnea basically says yes, let's move on. So we have, I want to say a little bit about the team. The uniqueness of the team is really an important part of the ability to make sense of the system and the data. I don't think in this company, I need to talk about the importance of multidisciplinarity and the importance of sharing and co-owning the agenda. But this is obviously a setting that, in a sense, is quite indicative of how the team is much more than actually part, sort of related to a particular part of the project. It's actually really significant for the whole project. And another characteristic that we are maintaining is to actually share and make results available. So there is a booklet that it is already there. And we are actually, this is already being used for training. We're very keen also to show the very good work that code takers and all the system, all those teams, all the kind of backstage teams are doing within a very sort of constrained and regulated system that, in a sense, often makes it very difficult to actually navigate around it. So this is then in itself, it means that apart from the sort of knowledge production or knowledge exploration part of the project, we're actually applying this, we're working with all the stakeholders into this very complex system. And through that, we actually also discover both more aspects, but also more ways and more ways that actually that we need to understand that the sort of the reading of the different texts is constrained or is actually filtered through particular environments or particular priorities that teams have to actually follow and adhere to. More information is there, and we also are launching our first conference, which is open now. I believe we even have a page for that, and so we're going to take the call to the various different fora, so you will actually see this. It is the first event where we want to bring those who actually do work on dispatch decision-making in complex systems and emergency services, not only health, to really share practice and to see how we can actually learn from each other about both the theoretical and methodological approaches we have, but also how we can translate evidence from the projects that are currently aiming to sort of contribute to improving current resource and feeding into future systems and improving future systems, but also in terms of the sort of policy implications that we can have. 10 minutes. We wanted to have much more for discussion. I want to pause and give, first of all, thank very much all colleagues who made time to stay with us, but also stop talking and open the floor. Michael, back to you so we can actually have some time for questions. Thank you.